There's been a lot of hype around value-based care over the past 5 to 10 years, even though we haven't yet seen many tangible, meaningful wins. It continues to be of interest to investors. Do you foresee that changing over the coming years?
I'll take a shot because I think I talked about value-based care. I don't agree with part of the question that there haven't been many tangible, meaningful wins. I think there have been a lot, a real lot of them. But, it's a question of what you define value-based care at. Is it the full delegation? Is it partial delegation? Is it partial sharing of risk? There's tons of models to be able to do value-based care, which in my view is just creating more alignment between the payers and the providers and the consumers.
I don't see anyone saying less value-based care, if anything more, but value-based care has added an element of complexity in our healthcare delivery system, and smaller providers seek larger partners. And if providers are holding risk, they want to spread that risk. And I think there have been some consequences of value-based care. I know in the research environment, there's a lot of my researcher friends and colleagues, and probably myself included, that is taking a closer look at the corporatization of healthcare delivery. And I see that as kind of a consequence, somewhat, one of the consequences of value-based care. So while there's no, I think, pushback against value-based care as an important movement, I think some of the ways that the healthcare environment has responded to the new incentives to develop these new models, I do see some added attention to whether that's a version of healthcare delivery that is beneficial to society. And so maybe that's over the long term, there'll be some attention, greater attention to that, and maybe some pulling back. But in the short term, the next 5 years or so, I think it's full steam ahead.
You do see them work. And I think you also see them when they're highly localized and well-funded and doing what needs to get done. You actually see huge impact, not just on the actual cost of care, but on the community at large. And so I am very supportive of that. And we need to be thoughtful and mindful of how we put those models together in order to create the sustainability for them. But I think that there's a huge opportunity for us to do that and to do it well.